please meet the lovely Carrie Smith, who I was introduced to by the amazing Laurie Edge-Hughes, and I am so, so grateful because what an amazing person she is. I'm just going to do a little bit of a shout out for the CAM book, which you should all know about now, which is the children's book. Do you know about this, Carrie? Have you seen this?
I do, yes.
Yeah, so this is the children's book that was written to try and minimize the amount of dog bites that happen, and also try and get families to understand how dogs present pain, so that we can basically live harmoniously together for as long as possible. Cam really, really wants people to be spreading the word about this book. We want pharmaceutical companies to be giving it away with their non-steroidals, with their pain relief. We want supplement companies to get involved. This is a book that we really feel needs to be disseminated. So I'm going to put that away. Now back to the amazing Carrie. Tell us about you. Come on.
Oh, well, what do you want to know? So, I have a human practice and a canine practice in Ottawa, just outside of Ottawa. I am 90% canine, 10% humans. And the humans I still see, I'm trying to get rid of humans. The ones I still see are usually the owners of the dogs that I treat. So, this is why all my patients want to keep their dogs living as long as possible, because I won't treat them unless their dog is coming in at the same time.
I like that. I like that. That's a really good filtering system,
It
isn't
is.
it? And so you have done some amazing stuff for us. I'm just having an issue with blinds. Do you know what? It's everything today. Everything. I'm
One
about
thing
to break the
after
blind now.
another.
There we go. There you go. Tell us about your cruciate thing and how we got in touch so that we can send people over to YouTube to go and access it.
Yeah, so Hannah and I did a series of interviews or whatever about my cruciate program. I've been treating post-op cruciate dogs for at least 15 years, and started doing some stats on them. And the general statistics are 50% of dogs that tear one knee ligament will tear the other knee ligament. And I thought, as I was seeing these dogs over these years, that our stats were probably a bit better than that. And we follow a very specific protocol. It's a 12-week exercise program. Every dog is looked at by a physio. We use all kinds of different things in this program. And I looked at the statistics over 15 years, and I need to talk to a researcher because I think this would be a great research project, because our statistics were 18% tore the
That's
second side,
amazing.
not 50%. So I think that's huge.
Huge.
Huge, but we haven't done it up as an actual research project. So I think I have all the statistics. If you know anyone who's in research, I'd love to get together with
Anybody
them.
who wants to step forward and help us with this, I think that would
Yeah,
be amazing.
yeah.
Because, yeah, I was just chatting to Laura and she said, oh, yeah, my mate Carrie, she's got this. I was like, right, I'm going to have to meet her. So that chat is a 5-part series on YouTube. Guys, all you need to do is go to the Canine Arthritis Management channel, type in Carrie, and you will find all 5 episodes. So please head over there. But tonight we're going to talk about something different. We've got 3 cases that we can present, which are Carrie cases. And they're there for discussion. And Carrie's really keen for people to contribute as much as to listen. So if you're a PT and you've got some thoughts and ideas, please do step in. I seem to have got a sudden tan. Have you noticed that?
Yes, I wondered. Have you been in the South recently?
I know, I've self-tanned myself. I'm relying on nature to provide the lighting, and I think it's having a bit of a laugh with me.
It must be sunset there.
No, just going to laugh my way through tonight because it's just going wrong. Right, so let's start. Let's start with who? Who do you want to do? Emily or Corduroy?
Let's do Corduroy.
Okay, let's do Corduroy. So.
Okay, so these are all actual patients of mine. There we go. So Corduroy is a 7-year-old mini poodle doodle kind of cross, and really fit. Owners are big hikers and boaters, and he goes out for a whole weekend hike all the time. Last year, what was the date on that? 2020, I think.
It was 2019. He had his first.
2019, his first. He was chasing around the yard with another dog. Had a really quick change of direction. Big yelp, kind of collapsed. Trouble walking. They went to emerge right away. He ended up having an MRI, and they saw a disc herniation at L7S1. So they did
Mm.
surgery a day or two later, and they ended up doing a fusion at
Mhm.
L6, 7, and S1.
Wow.
And did well after surgery, kind of back to sort of pretty much normal activities.
Explain to the followers what a fusion means. What do you mean by that?
Okay, so each vertebrae normally slides on each other a few degrees, right? That's what gives us movement through our spine. And so what they do is put a plate and screws in to hold those three segments still so that
Mm.
it stabilizes the area and it doesn't stress the discs and the nerves in the area. So it's a fairly big surgery. Now the problem is the body has to move, and the
Mm.
body will start moving the vertebrae above or the vertebrae below more to make up for that loss of movement at each level. It's about 3 degrees of movement at each level. So that's 9 degrees of movement we've got to take up somewhere else in the body because it
Wow.
naturally needs to move. So you start to see breakdown in different parts of the spine after you've had a fusion. So it, sounds great to go and stabilize the area, get rid of the pain so the dog can function again. But you've got to be very cognizant as down the road you're going to have problems in other areas of the spine because you've lost those degrees of motion at one spot. But he had recovered, pretty normally. I don't think they were playing like frisbee and big tug games and stuff with him after that. But he was fine, and they ended up having an abdominal hernia the following year. Had a
Eee.
had an abdominal hernia operation, which a fairly in a little dog was a fairly big surgery, and they put mesh in to help sort of stabilize where the hernia was, and they sutured him up, and wouldn't you know it, he kind of had an allergic reaction to the sutures, and they all the instead of dissolving by themselves, they all started to come out through the skin, and it
Right.
was all infected, and it took several months to sort of settle back down again. And again, he kind of did okay after that and was sort of back to his sort of normal self. And then not long after that, it was winter here. He was playing in a snowbank like all Canadian dogs do, and he re-injured his back because, right, he's stable in one area, but he's moving too much in another area. So he tweaked his back, became kind of weak again in the hind legs, and his hind legs would sort of shake. And took him to the vet. They didn't feel he needed any like surgery again, but he just hasn't come around. And now so this is about 6 months later. Well, since January is when he had this flare up. And since then, he's been going into his crate. He doesn't want to be touched. Abby says if the leash touches his back, he screams, he goes crazy. He won't allow anyone to pet him. His whole personality has changed, and we don't really know why. And so sometimes we call this allodynia, which is sort of pain for no it's not for no reason. We don't know exactly what is driving his pain, but he
Yeah.
is in pain.
And I think this is somewhere where we should pause and kind of like translate it to OA cases. And this,
Mhm.
I was definitely taught this at uni, but I think it was then parked until later in my career it resurfaced again. And allodynia basically is where your brain is misinterpreting signals. So when Carrie was talking about the lead touching the back, instead of the brain going, "Oh, I've just been touched," the brain goes, "That was pain. That was pain." And there's a confusion at essential points of where the nerve transmission goes up the peripheral nerve to the spine, up the spine to the brain. And there starts to be miscommunication, almost like a telephone operator's messing up the leads.
Mhm.
And the reason we want this case to be mentioned is because allodynia happens in dogs with arthritis. And I feel quite a lot of guilt at times for the amount of cases that I might have gone, "Oh, he's just being difficult," when you're trying to handle a dog. So maybe you've got a dog in, they've got severe hip arthritis, um, and you're picking them up to put them on the table, and they go for you, or you're just trying to do a subcutaneous injection quite distant from the spot, and they really can't take it anymore. They've become completely intolerant. And I wanted to flag this up because if your dog is beginning to show quite profound behavior change to what was normally quite innocuous, you should have something like this in your head and just get it checked out. So if you go to pat your dog down his back or groom them and they really dip away, they don't want to be touched, and they try and avoid touch, like you're describing, going and hiding in the crate, you might find, a dog with severe arthritis who have become allodynic. They shy away from the family. They don't want to be sat next to on the sofa. They choose not to sit on the sofa. They become quite aversive to being touched and almost aggressive to prevent being touched. So this is why this allodynia case is here. We're not specifically talking about arthritis, but it's a really good illustration of allodynia. There you go. Stop
They,
rambling, Hannah.
no, it's good. And he's at the right age to be developing some spinal arthritis, and he is going to be for sure because of this extra movement that he's going to have to start to compensate for from the fusion. So there's more stress on the rest of his spine, there's more wear and tear, and all of those things are part of the arthritic change process. And so when now he came to me, I've treated him many times before, and they came to me because they were kind of stuck. Like the vets had given them some medication they thought would help, and Hannah's going to talk a little bit more about what medication he's on right now, but it didn't really seem to make a huge difference. And so they came to see me because more of behavior problems rather than any necessarily physical problem, but they wanted to rule out a physical reason for the behavior changes. And they are so concerned they're actually considering euthanizing this dog because he is not the same dog, and they don't feel like he's having a good life. They're frustrated, he's frustrated. It's just really not a great situation. So when I wear my physio hat, we don't prescribe anything, right? We don't prescribe medications, not my scope of practice. I mean, I find out what they're on, but not my scope to be discussing dosages and different ideas of medication. So put your physio hat on. What what mechanical things might be causing some of this pain? And we know from all our human medicine that this is a sign of neuropathy, like meaning the nerves are all jumbled up and the nerves are getting really irritated, and that almost always comes from the spine. And when I would palpate his spine, it was very stiff, and he would quiver. Like they'll often get these little quiver areas and twitches at different levels. And so he was actually not that bad over the surgical site in his low back, but in his mid back, he was quivering all over the place and just like was trying to shy away from me and didn't want anything to do with it.
Let's
Now,
just spend a little bit of
yeah,
time here. So did he kind of like turn at you? Did he
yeah,
were you ever worried that he might nibble, or was it the whites of his eyes? Was it just, as you say, dip away?
yeah. He's a very friendly dog, and he's known me for years and years. So he wasn't aggressive. He was avoiding, right? So he would try to like run behind his owner, and we had to make sure the owner had a good grip. Now, we're always careful. We don't want the dog being like, I don't want to get bitten. They don't want to bite. The owner doesn't want that situation. So we're always very careful of watching his body language. But he was just avoiding me, right? And the other thing is with the abdominal hernia surgery is what triggered my brain the most, because after any surgery, anytime you cut through the skin, you cut through the fascia, and the Hannah, if you want to show a picture,
Yeah,
that
I can
picture of the
show that
fascia.
picture. Let me get it up.
Fascia is a very, it's like saran wrap underneath the skin, and it covers every muscle and every organ and every nerve and every bone. And you see how it's kind of glistening there. Now, the fascia looks like kind of a big, massive spider web. The fascia, now this isn't his fascia. I just stole this from the internet, but the fascia should be much thinner than it is there. Do you see how it's all kind of clumped up together here? And those are what we call adhesions. And anytime you cut through tissue, you cannot avoid this. As soon as you cut through that layer of fascia. And as soon as there's surgery and scar tissue developing, because that's how everything heals, it binds that fascia up into these ropey areas. You see, I can't show you on my screen, but you see where it looks kind of ropey.
Yeah.
And it should look very smooth. It should not look ropey like that. And so there is a manual therapy technique we call visceral manipulation or myofascial release, where we can go in and really softly stretch that out. So
What one of them?
those ropey pieces are like pieces of Velcro stuck together, and we can slowly unvelcro the dog. And so my first thought as a physio is, okay, I'm going to treat him with this sort of myofascial treatment, and because it physically can make you stiff. I tell owners it's like trying to run wearing a scuba diving suit. So
Mm.
you can run in a scuba diving suit, but you're not very efficient. So you take off the suit and all of a sudden you got freedom of movement, right? So having really tight fascia just doesn't make anything move properly. And that can be part of the pain experience, because that can be pulling on the nervous system and on the facet joints and on the bones and on everything. And it's a very gentle technique. Dogs generally love it. They usually totally relax. So when I started doing that treatment on him, he literally laid down and let me touch him. So rather than starting maybe with acupuncture, that is a little bit more aggressive because they can feel that it's not usually painful, but they can feel the needles. This is a really, really relaxing type of treatment. So we did that for a few times, and he showed improvement like right away, but not a huge amount of improvement right away. The owner said, "You know what? I could pet him yesterday. He wanted to go for a walk. Instead of going into his crate, when they asked him if he wanted to go for a walk, he wanted to go for a walk. So that's a big change, right? So all of a sudden, we've made some changes in how his body is moving, but it wasn't hugely significant. And I do sports stuff. I work with rugby. I like instant changes. I'm not. I'm all about the quick. Like, let's get this fixed and let's get this fixed as soon as possible, because that's sort of my background. So even though it improved, I'm like, what else could I possibly do with this dog that could help this nervous system feel a little bit better? And there's a technique called kinesio taping. We use it on humans all the time. This is the tape. I almost never use it on dogs because the dog's fur is, as you know, obviously much different than human skin. The fur or the dog skin is really loose and really so you're not. This isn't taping to stabilize anything because the skin is so loose, and the tape kind of sits on top of the fur. I had the owner shave a couple strips so we could get a little bit closer down on the skin, but it because they have that layer of fur, it sits on top of the fur. And what it's doing is tickling the hair follicles, and that is attached to the fascia underneath. So all we're doing is giving the fascia a little bit of a wake-up call, saying, "Hey, we're here to support you." And if you've ever had kinesio taping on yourself, it's super comfortable. It is not like an ankle sprain. When we tape a joint so it doesn't move, it's firm. It's not going to let your joint move. Kinesio taping is a flexi tape. It's meant to work with muscles and fascia and skin, and it's really comfortable. So we thought, you know what? I have this person in my office. I have to do something. And this is where we can't always look 100% at what does all the research say? What does,
Well,
what's
this is what I was
everything
going to step
showing in the
in.
research,
Yeah, because I'm in my brain, so I'm thinking, right, the dog is reactive to a mechanical touch, so the last thing I would be thinking of doing to this dog would be adding more touch to the treatment plan, because it would just make his life miserable. So this is a case to discuss. This
Mhm.
isn't we've all got the answers. Being a vet, I would have just bashed on with pharmaceutical more, and I would be going, right, what drugs am I on? What reason are they there? Are they be given at the right dose, the right frequency? Have I got a good plasma level for each of the drugs? What else can I add, and why am I adding it? Because I would have stepped away from touching him. And this is what's fascinating about this case, is that you've done the opposite
Yeah.
and it came good. So carry on
Mhm.
explaining what actually happened.
Mhm. So I had the owner. Do you want to show the strip, the where how we taped him? It's
Yeah.
just literally two pieces of tape. She would put them on before she went for a walk. So he would walk with the tape on. He didn't mind the tape being on. He would walk, and you can see it. We focused around the mid back because that's where he was most reactive. This is just the shaved area. There's no gel or anything on that skin. Um, and we thought, you know what, let's try it. Like we try the more things as a therapist you have in your toolbox, the more things you have to try. And so just sometimes you have to think outside the box a little bit and like, what do I have that can help calm this nervous system down? And we use tape all the time in humans to calm the nervous system down. So let's give this a shot. And so 24 hours after we started taping, she texted me. He jumped on the couch. It was the first time he let the owners pet him since January. And to
Mm-hmm.
me, that's significant. So that's what I'm looking for with a treatment effect, right? I don't want if she has to say, yeah, he was like 10% better, or he walked 10 houses more, that's not a significant change. Jumping on the couch to be petted at night is a significant change since he hasn't done it since January. So
Yeah.
I
Only
don't
thing
really
I'm
know
going to just
why.
butt in there. I'm going to butt
Mhm.
in there, not to allow the seed of I haven't seen such dramatic changes like Carrie wants to see. And when people are seeing subtle changes, don't be despondent,
Right.
okay? Because some cases it is going to be a slow turnaround. Carrie loves rapid change, but Gwen
That's
Covey
my
Crump will,
personality.
yeah, Gwen Covey Crump will be looking for a slow, steady improvement. There are different approaches. I just don't want anybody somebody whose clinician has just said, yeah, we've seen a slow improvement. You know, their pain is lowering slowly to feel really despondent because
No, absolutely not. But and because in my practice, I'm used to seeing, I have a 3 treatment rule. So if I haven't seen a fairly significant change by the 3rd treatment, I'm batting up the wrong tree. I'm not doing the right thing to help this dog. So this was our 4th treatment, right?
pause on this as well. I think this is a really good take home for lots and lots of people. In that, I know that we do laser in like twice a week for 3 weeks, and we have hydrotherapy that will do 6 sessions before a decision is made. But have that conversation with that therapist of where's your rule of thumb. So when I was doing my clinical massage with vet work and lifestyle and going to people's homes, I'd be like, if you're not seeing improvement on 3 visits, then I'm not the right person for you.
Mhm,
And I think it's a really good conversation to have with people. What should be my expectations so that we can work together on this?
mhm.
And that is part of the multidisciplinary team, isn't it? If a myofascial person wasn't getting results, then they should go, right, we've done 3, 4 treatments, we're not seeing the benefit, we're going to change tact. And that might mean
Exactly.
I encourage you to see somebody else who has a different skill. But anyway, continue. So 3, you were on the 4th occasion.
Yeah. So this is the 4th. And that's exactly right, Hannah. I think we sometimes as therapists get protective of our patients, and we want to fix everybody when we may not have the tool that patient needs, right?
Yeah,
So don't be afraid to send them. Doesn't mean you failed. It means we tried this. We're not going to do 10 if 3 didn't make a difference, right?
yeah.
Like, who else do I have in my area that could help this dog, right?
Mm.
So, but this was the change. So I had done 3 treatments of like fascial release, and he, tolerated it, wanted to walk a little bit more. But the biggest change we saw was when we added the taping. Now, coincidence? Maybe. I scientifically can't tell you why. It's just we've got to try something. So what else is, think outside the box a little bit. There are body wraps you can do, sometimes like a thunder coat. I don't know if you have them over there. Compression, nervous system likes compression, right? So a thunder coat may help this dog. So start trying different things
When you
when
talk about the nervous system likes compression, again, I'm just going to be a facetious little kind of wall sitter. Um, to have influenced the nervous system to a great degree, compression, do you mean you're just stimulating it? Like you're in multiple areas sending messages to the brain, I'm here, I'm here, I'm here, I'm here. And the brain just going, I haven't got time for pain.
mm,
I've got so
and
much that I'm listening to from
and
other
there's
places.
so much other things going on. This is the study that comes from autistic children with
Hmm.
Temple Grandin and the cows, right? So we know that that's why we swaddle babies. We
Hmm.
swaddle them to relax them, calm them down. Um, so in rehab, we know sometimes if we we do a body wrap. Tellington Touch does a lot of stuff with body wraps, if you're familiar
Hmm.
with that group of people, because it's extra. I don't. It's a connection. It's connecting the front to the back. It's connecting the top to the bottom. It's creating this feeling of comfort almost. So whether or not it's stimulating so many different alpha and beta fibers, I can't tell you, and dampening down the C fibers,
Mm.
but it's something to try when you have kind of a whole body pain. And one of the in IMS means intramuscular stimulation, and it's a type of dry needling technique that we do on animals and on humans. But the research from that is sorry, my phone is dinging, and now I've lost track. The to treat neuropathies. Oh, I totally lost it. We're talking about compression. I don't know why I went off on IMS. But anyway, it'll come back. It'll come back to me. Sorry, you should turn your computer dings
This
off
is
while you're in
life.
the middle of like what?
This is
Anyway.
life. But I think what I found just really interesting when you were talking about this case is that, as you say, you go down a pathway that to you is clinically reasoned. So for me, a clinically reasoned path would be going pharmaceutical first.
Mhm,
I probably would have gone acupuncture first because I would have thought there was minimal mechanical impact and maximum effect of the needles on the endorphin levels, on the pain gate.
mhm,
And I would have gone that way, whereas you've gone a different way and you've got
mhm,
amazing results. And I think
mhm,
that's something that's really hard for people to understand is that nothing comes with a promise and you do have to think on your feet.
mhm,
So this case, let's just kind of recap. The case was to illustrate a condition that a lot of people won't know about. Allodynia, it exists and it is a common finding with significant OA. These dogs don't need to be necessarily severe OA cases in gross remodeling. They can actually have quite mild OA, but
mhm,
their body interprets it really badly, gets confused, and more pain is perceived than is actually being created. And these dogs will present averse to touch, significant behavioural changes. And we ourselves need to be really receptive. And a lovely lady has just put, I think my dog who is on Librella is showing signs of allodynia. She will not let me brush her anymore and
mm,
rarely gets on the sofa with me. So that's classic. Have a chat with your vet and just say, this isn't right.
mhm.
Why does she not want me to touch her here when the actual focal problem is here? What's that about? So that's one part of this case. The next part of the case is, you can clinically reason to the cows come home, and then this lady does something completely out of the blue and it works. And then the final part of this case is, let's try and talk out why it's working so people can understand how these physical therapy techniques can work. And for me, the way that my brain would understand it is that that tape is stimulating the nervous system with innocuous signals, not noxious, innocuous, just touch, movement, proprioception, as Sarah McGigan is saying. And that is going to the brain. And the brain has only got a certain amount of space. It's like a little a passageway. It's the passageway of information to the brain. You can't have everybody go through that passageway. It's not wide enough. So it goes, pain, you can't come in today.
Mhm.
I'm dealing with touch. I'm dealing with movement. I'm dealing with proprioception. I can't perceive pain at the moment. And I wonder if it's more of the pain gate rather than the physical change it's doing to the area. But what do you think?
Or are you talking to me? Okay.
Mm,
I think I don't know that we can say one way or the other, but
mm,
I think it's definitely we tape for proprioception, meaning we're waking up that we're helping the brain say, hey, pay attention to this, help this area. It's hardly any stimulation, right? It's literally hair follicles. Um, and they just feel more comfortable. And if you have a sore knee and you put tape on, you will be able to walk better,
mm,
regardless of what structure you're trying to treat with the tape. And this is why if you watch the Olympics, every diver has tape on, every
mm,
volleyball player has tape on. It is a proprioceptive tape that helps those muscles, that rotator cuff to fire, to smash that ball, across the net, sort of thing. So it it I'm not a scientist. I can't tell you. I just look for clinical changes, and this was something that I wasn't even expecting to see happen, but amazing. So now our next steps with this dog, if if his pain is calmed down, you know, the next time I can try acupuncture. I can try
Mm.
different things. And Hannah is going to send me sort of a list of meds she thinks we'll talk to the vet about and see if we can get this dog back to his normal behavior and his normal physical
Yeah.
activity. Mm-hmm.
And I think you've just kicked up another really key important thing is that all of these cases require monitoring.
Mm-hmm.
And you've seen
Mm-hmm.
improvement, and now you're like, okay, so let's see if we maintain this. What can we do to maybe improve it? And I think there's a real tendency, and I've certainly seen it a lot, where people go and see a vet or a therapist and they get put on a treatment. And because that person has taken control of that situation and said, here you go, use this, they go, here we go, it's going to work.
Mm-hmm.
No, it doesn't.
Mm-hmm.
It does in a lot of cases, but not in all of the
Yeah.
cases. So we do need to make sure whatever intervention we choose actually has a desired effect that we
Mm-hmm.
want. So loads of information in this case, which I think is really brilliant take homes.
Mm-hmm.
Kim says, wouldn't it be like a TENS unit for an adult where can we find this tape and can it be used on cats?
Good luck trying to tape a cat.
Yeah.
I've never done it. I wish you the best of luck and send me a picture and a video if you can do it. But it shouldn't be much different. Kinesio Tape is all human physios would know about it. It's just kinesiotape.com. And they give you there's a free downloadable book about it if you want to read about it a little bit. Um, it and I think you could relate it to having a TENS machine on, right? A TENS is electrical stimulation, again, waking up the area. But I think it's harder with dogs. You've got a gel and it slides off, and it's not so
Mm.
easy to use. But we're creating a low grade little stimulation, and so I think you very likely could relate it to TENS. Yeah,
Yeah, I think so
yeah,
too.
yeah,
Similar principles.
yeah,
Okay,
yeah,
so let's put corduroy away. And
yeah.
let's
He's doing
talk
well.
about our next one, which I'm really glad that you've put this one up here
Yeah.
because Emily really illustrates something else that we don't talk about enough. And I think a lot of dogs are, I'm not going to use the right terminology, we potentially give up a bit too soon
Hmm.
because we fear the worst. So I'm just going to give you a typical vet scenario. So I'll be working as a vet.
That she didn't fall over. She's just intentionally rolling her. That
She
that
just
wasn't a fall, just so you know.
so it's quite common for somebody to come into a vet practice and their dog has had mobility issues for a while, and they will say to me, right, we've come to the end. He's had a sudden deterioration. Everything's gone wrong within literally the last 24 hours. It's progressed. And I'm sitting there going, no, it's probably an acute episode on top of the chronic. And if only we can have a bit of time,
Mhm.
we can hopefully come out the other side of it. And this is only something I learned kind of later in my career. So explain to us what happened with Emily.
So Emily is a 16-and-a-half-year-old Malinois, which is very old for a
Incredible.
Malinois. And this is her back property. She's going on her little hike here. She is full of arthritis. I see her weekly. She has hardly any movement in her back, but the worst thing is her carpal joints. And could you see how floppy her front legs are? She has like no stability. It makes you queasy as a practitioner to look at them because you're just like, oh my God. But she's been like that for probably 6 years. Uh,
Right.
and do you have a picture of the braces? Did I send a picture
Yeah,
of
yeah,
the
that's going to be coming
braces?
up soon. Yeah.
The owners are very, very dedicated. And when she started first having this carpal instability, we said, okay, we have to stabilize this. Like this dog can't walk around on flippers, right? So we got some braces for her. So here she is just in sitting, and you can see how lax she is in sitting. But there's her braces. And so for about 4 years, she plopped she would go up and downstairs, in and out of the house, go on her. She goes for about 3 30-minute to hour walks a day.
Wow.
So tons of activity. And she did really well with her braces. And then it got to the point when she was probably when she was about 16, close to 16. She kind of was getting fussy about the braces. So the owner just said, you know what? She's this old. Let her do what she wants. So she just literally walks on these flippers and is as happy as a clam. Now, they watch her all the time for pain. They've already had end of life discussions with their vet. They know who's going to come out to the farm to euthanize her, but she's not at that point yet. But they're very cognizant of her not going into distress and making everything a calm transition. And so I got a call from the owner about 3 months ago. Oh my God, I think we have to euthanize her. She can't walk on her left carpals. It's all swollen, and she's really not weight bearing. So we arranged for her to come into the clinic for me to have a look. And I think it was just a carpal sprain on top of an ongoing chronic problem. So yes, she had some swelling in her wrist. Her range is terrible anyway. It's so loose anyway, you could hardly tell. But she wasn't in too much discomfort. Her toes were moving. Her elbow was fine. Her shoulder was fine. So I'm like, look, I think she's probably just twisted her wrist, and it's like an acute sprain. You cannot euthanize for 2 weeks. And that's what the owner needed to hear. Okay, I'm not going to make any major decision. I trust your judgment. I'm going to give it 2 weeks. If she's like this in 2 weeks, we're euthanizing. And guess what? In 2 weeks, she was pretty much back to normal. And that was 3 months ago. And she is still living life large. So we put this in just to make sure, don't jump to conclusions if you're not 100% sure what's going on, right? Like,
Yeah, and I think we could play with this with so many illustrations. I've had a dog. I'm afraid I look like Holly, the holographic out of Red Dwarf now. It's all just going wrong, isn't it? If you remember, she just has a head in the dark and she just talks
well,
to
it's
people.
it's almost Halloween.
I know. I just give up tonight. So yeah, I've had dogs where they've been riddled with arthritis and musculoskeletal pain, and then they've got an ear infection or they've got a tooth infection, and that pain doesn't seem to stay localized to the tooth or to the ear. It just causes the whole body to go, oh, this is the straw that broken the camel's
Mhm.
back. I can't deal with this. So there's that kind of illustration of acute on chronic, not just a deterioration of specific joint. Now, me and the lovely, amazing, awesome Gwen Covey Crump will be doing 2 nights of live. I think it's next week, about breakthrough pain, and that's a kind of terminology that's used for acute on chronic as well. And there's different reasons to have that breakthrough pain, and this acute on chronic. So
Mhm.
her having an incident that's flared a joint, turned it into an acute inflammatory situation again, really ramped up those pain signals, and the owner thinks we're at the end. But actually, a lot of these cases give them time. So an acute
Mhm.
flare, what, 10 to 14 days,
Yeah.
as you said, and you can be doing lots of things in the meantime. It might be that you up your
Yep.
medicinal component. It might be that you start using maybe some cryotherapy. It might be that you have to actually use thermotherapy. It might be that you have to get your dog up moving little and often lots, but no actual walks,
Mhm.
completely reduce the walking, but just have them keeping moving so that they're, for licky mats, for snuffle mats, whatever it is. But there's lots and lots of different approaches. You might go hell for leather with laser. You might go hell for leather with
Mhm.
acupuncture.
Mhm.
What sort of things have you done for acute flares?
Well, for Emily specifically, we kind of did all of that. So we had her in much more than we normally would. We lasered it. She's fine with acupuncture. The doc upped her medication, and we just took her off her 3 walks a day and just let her kind of go around the yard, and that was it. And literally within 2 weeks, easily, it was obvious that it was settling back down again, and so she's back to her normal arthritic in unstable self, but happy, and you went for a swim by herself in her own pool the other day. So she's
Amazing.
so it's, and we're hoping she gets to 17, and we think she will, right? She's doing amazing. So yeah.
Okay, so just talk us through what other things that you do in her PTOA
Oh,
management. And I'm
sure.
going to
So
turn the lights on 2 seconds. You stay
I'll
there.
start talking.
You carry on.
So I see Emily weekly, and a weekly used to be sort of monthly. Now it's weekly. And I do acupuncture. So I do a lot of sort of energy points, a lot around her lumbosacral spine and her hips. I do. And then I sort of do laser on the points that I don't want to acupuncture. There are points we call edible points because the dogs can actually pull the needles out. So on those points, I laser her. And then I do a lot of that myofascial release that we were talking about with corduroy, which just sort of helps sort of relax her whole body and just keeps her moving.
Mm.
And so if she stops moving, she is going to go downhill. And the reason she's done so well is because she has such an active lifestyle. Her owners are retired. They can spend all kinds of time with her. She doesn't lie, in the house in a crate all day. She's moving constantly.
I
So
think
that,
that's a massive
yeah.
thing.
Hmm.
That's
So,
definitely a massive thing. And
yeah.
one of the reasons that within the cam shop we have a lot of enrichment stuff is because the theory behind it is distraction of the brain, and that's where pain is perceived. But also, we want these dogs to be up and doing
Hmm.
micro and macro movements. We want them
Hmm.
to keep moving. And
Hmm.
the last thing we want them to do is just lay in their bed all day.
Right. Yeah. Yeah. It's like if you've had a flu and you've been in bed for a week, you can hardly move when you start to feel better and you want to get out of bed.
Doesn't
We
need to be
know.
a week. Me overnight
No,
now. I
I
get
know
up in the morning
overnight.
and I'm
Like,
just like, oh my
what's
God.
what's not working this morning?
100%. I've been down in Cornwall, been surfing, and I'm just like waking up in the morning going, "Oh, good God,
Oh,
what went wrong? How old am I?" So no, it doesn't have to be long before you really do stiffen up, don't
yeah,
you?
no, for sure. And so when we went from monthly appointments when she was probably 12 and 13 to bi-week every 2 weeks, and we saw a big difference. And then we went to weekly and saw a big difference. So what I generally do with the seniors with the arthritis is you want to treat them just as they're starting to go downhill again. So you want to treat them, give them a boost before this happens, right? And so as they get older, that treatment time in between kind of becomes shorter because we keep her energy up with the acupuncture and the laser and the treatment, so that, and she's on a regime of medication all the time. um, but it keeps her mobile, and when we start to see that she midweek is starting to go down, the owners are will go maybe twice a week instead of once a week. So
Mhm.
so we find it just really keeps her energy up, and that allows her to keep moving, right?
Okay. Give
Motion is lotion. Hmm.
motion is definitely lotion,
Hmm.
and I think something to put in now because we're going to be talking about it on Thursday. The lovely Chelsea's coming back. And we're going to be talking about when is enough enough, and not talking about lifespan. We're talking about interventions.
Hmm.
And we know that a number of people have they've got a little bit downhearted recently and flagged up to Chelsea that they just don't feel that they're doing enough, and being exposed to everybody else doing so much is making them feel uncomfortable and potentially guilty. What you guys have to remember is that every dog is different, and some dogs will lap up all of these different
Hmm.
interventions, and some dogs actually really do very well on 2 or 3. And when I'm talking about interventions, I mean as little as a licky mat, as little as a
Hmm.
rug, as little as sorting out the steps to the back garden, as little as don't let them chase the cat in the dark.
Hmm.
You know, make sure that they've just got a bed in the back of the garden. These are all interventions, and I think a lot of people get put off by price points and
Hmm.
that commitment to see you. So just because this lovely owners were able to take advantage of Carrie's amazingness and availability, don't let it make you feel
Right.
guilty. Okay, is that fair to say?
100%. Hmm.
Do you have clients that you don't see very regularly and you still get a lot out?
Oh, all the time. Yeah. And again, when they start coming, I always say you need to give it 3 treatments. Like I always have that 3 treatment rule. And then here's what you can do at home. Let me see you if there's a change. Let me see you at the different seasons. So a lot of times I like to see dogs going into winter because as winter starts to approach, joints get stiffer. And so I often will see them like November, or if they're sport dogs at the beginning of agility season. So there's lots you can do in between
Hmm.
at home, right? So
Yep.
but the biggest thing is sort of the exercises and things we give you to do at home, because that's what they're doing every day. They're not seeing a professional all the time, but you're seeing them all the time, and you have to be consistent with what you're doing at home with them every
Yeah,
day.
definitely.
Mhm.
Got a good question from Luke. Luke, the hairdresser. He's lovely, Luke. Um, talking about myotherapy compared to physiotherapy. So I don't know if you know myotherapy.
I don't know what.
Myotherapy is so it's therapy of muscles, So that's the literal interpretation, isn't it? So it's the massage component of
Mm.
physio.
Mhm.
So my interpretation is myotherapy clinical massage, whatever you want to call it, is one of the tools within a physio's toolbox. So some people follow the manual therapy route more and maybe develop some new techniques, learn some new additions, and they don't want to complicate it with other additions, be it TENS, be it laser, be it ultrasound, be it heat therapy, etc. A physio has a bigger toolbox, so that's just one of the elements of what they use. Why the physio wasn't showing as much beneficial effect as myotherapy, maybe the physio was a lot more hands off. Maybe the physio was focusing much more on therapeutic exercises, which are going to take longer to take effect. I've definitely found some manual therapies you can get in there and get some really great results really quite quickly, can't you?
Yeah.
And you wouldn't be able to get the same with asking the owner to perform stretching and balance exercises.
Right.
Fair? Would you say the same?
Yeah, and like as far as I'm concerned, myotherapy is just part of what we do all the time anyway. So if we work lots with massage therapists, and so massage is a great tool, right? You're getting in, you're working trigger points, you're helping blood flow. As long as it's working, keep doing it. You don't need to try a whole bunch of different things if something is working. Right?
Yeah. And Luke's just added, this is quite funny. This dog is very well looked
Oh.
after. She has laser, she has acupuncture, she has hydrotherapy.
So she's getting everything anyway.
She's getting a lot. And it sounds like the physio probably was only left with therapeutic exercises to try. And
Because
they
she's doing
are
everything else.
always, they're always going to take longer.
Yeah, of
And
course.
they're going to take a lot of owner commitment as well.
Yeah.
And I think we were just laughing before we went live that one of the reasons you stepped away working with humans is because they never did as they were told.
No, they never do. And you know what? No matter how much liver I offer them, they still won't do their exercises. So that's why I pick the dogs.
It's disgusting. So please do get your questions in, guys. I know we've got a changing face. I've become an alien now. It's the changing light of Cornwall. But let's go on to our final case. And this is just one that you wanted to talk about because you just found it fascinating.
Yeah.
And I wanted to show this case because of the way that Carrie talks about it. She loves what she does still. And I think that's what you should find in a therapist. I think I know that I love what I do. And with that, I keep learning and I keep trying and I keep listening. And I think listen to her talk about this case. And this is what you need to find in your therapist. Go for it, Carrie.
Okay, this is the coolest thing. So Sidney is only 2, and Sidney blew his left CCL by chasing another dog. So it was an acute injury, young dog. They went in and did the surgery. And on the first slide, you can't see it very well, but they shaved the leg, obviously, for the TPLO. And they shaved this section over the spine just for a pain patch. And as we were rehabbing the leg did absolutely fine. But this big, so pause on this one, Hannah. So you can see the leg has grown in normally. And now you've got this huge bald patch over the spine.
Yeah.
So the owner said to me, well, I asked the vet about it and they just said, oh, it just happens sometimes. Don't worry about it. And so when I see that, that is a sign of neuropathy. So going back to the IMS that I kind of forgot about last time, one of the signs of neuropathy is hair loss. Now, in humans, we don't see it in women so much because they tend to shave, but in men, you'll sometimes see a big bald spot on a leg or an arm. And you're like, well, how come there's no hair here? Oh, I don't know. My boot must chafe. I'm like, well, your boot doesn't chafe on one side and not the other side. So you'll often see these areas of hair loss, and that is a sign that the hair follicle is not getting the right information from the nerve to the skin. And so that is a sign of spinal neuropathy. So things like arthritis, injury, all kinds of things can cause neuropathy. So this is not normal. If anyone tells you it's normal for hair to not grow back, it isn't.
Yeah.
So I was taking an acupuncture course online, and I do acupuncture, which is why I was able to take this online. It's not like I learned online. Okay, I'm not just randomly sticking.
Everybody's just going to sign up now,
right? No, you have to be qualified. All right, but I'm like, okay, I'm going to try this acupuncture technique, and it's called Circle the Dragon. So if you go to the next slide, Um,
Yep.
and
Yep.
where you can see the needles. So I was treating the back. I started treating the back more, than the leg was doing fine. So this is this huge bulb. So this is day one. Okay. We haven't started treating the back or the neuropathy. So this is day one. And you can see how I have the needles all around. And this is about a week later. And you can see already in 1 week the hair is starting to regrow. This is after 3 treatments.
No way.
3 treatments once a week for 3 weeks. That's start of treatment number 4. That's how
Now,
much hair
what's
had grown
the
back.
theory behind this circling the dragon? What are these needles
So
doing?
so this is one of the ways acupuncture works. Is the needle goes in, it's not supposed to be there. So the body, acupuncture is all about the body's reaction to the needle. Okay, it's not the needle. It's what the body is doing because you've stuck a needle in it.
Right.
And the body says, "Whoa, what is going on?" And it sends all kinds of chemicals and nutrients and blood and oxygen and all kinds of things. And they call it kind of a chemical soup. So
Yep.
it sends this chemical soup to the area to say, what is going on? Because the body wants to get rid of the needles, right? The
Yep.
body doesn't want the needle stuck in it. And so you create this huge chemical soup with all of these great, like acetylcholine and serotonin and all of these things that are all part of the healing process. And they are creating a huge stimulation to the skin, to the hair, and to the nerves, that because it's this sort of feedback loop, right, that we get from the peripheral nervous system to say, wake up and see what's going on. And so you can see all we needed to do was wake up this area to start to entice the body to treat itself again. Yeah.
I love it. I love
Amazing.
it.
Amazing. 4 treatments.
I know, and I think,
Oh,
as I
oh.
say, yes, the connection to OA is stretched with this one, but
Yeah, but
for
this is just
me,
fun, and I wanted you to put the pictures in.
yeah, I wanted you guys to just see, like, when you tap into people that love what they do, you get that
Yeah.
of absolute delight. And therapists, the ones that I hang out with, they get such delight out of seeing
Mhm,
improvement in their cases.
mhm,
It's just fantastic to
mhm,
see. So, are
mhm,
there any questions? We're going to hang around for a couple of minutes. If you have got some questions about your dog, I'm just looking back up here, see if anybody's put any questions that they would like answering. What we were trying to do tonight was just kind of do something a little bit different. We wanted to throw a few little kind of curveballs in here, talk about all the different modalities, see the amazing Carrie when she gets super excited. But if you have got any questions, do just put them in, or what you can do is put them in later
mhm.
and we'll try around and get round to answering them. Thank you so much, Carrie. I
My
just
pleasure.
love hanging out with you because you're just so passionate about it still. How long have you been a
Oh, my
PT
dear.
now?
So I've been a physio since '85. So, oh, I can't count that high. Over 30, like 35 years. Oh, and in specializing dogs, well, focusing on dogs since 2004. So
2004. And you've
yeah.
done a lot of work with the agility team over there, haven't you?
Yeah, so I work with local agility, and I travel with our Canadian agility team to the World Championships. Of course, the last 2 have been canceled, unfortunately, but we're hoping for May. It's usually May in Amsterdam, so I will be over your way in May.
Yeah.
Mhm.
Oh, well, I've never been to Amsterdam.
Oh, well, maybe we could hook up. That'd be
Maybe we
amazing.
should hook up in
Ah!
Amsterdam. I like it. We've got a question here, and go for it. What's your thoughts on Reiki? So, where do you stand?
I don't do it. I don't know anything about it. I have lots of people I know who do it, and I have lots of patients who use it. So to me, it's a manual therapy. It If it helps, use it. Number one, it can't hurt you. Number two, if it works, keep going. Uh, all of those things feel good. They're energy work, right? You're inputting energy into a human or an animal, and that always improves. So
What about the Reiki where there's no hands on?
I
So,
don't know. I don't know anything. I don't know anything about the hands off stuff. I could. I don't know. I can't answer
yeah.
that because
I've
I don't.
again,
Well, I don't know how the internet works either, and I use it. So
yeah.
I'm totally open. I don't know if my car breaks down. I don't know how to fix it. But if it works, I would say if it works, use it. It's like anything.
Okay. I think my standpoint on it is the same as with all therapies, that I think people need to be given the get out card of, if you're not seeing any benefits,
Mm-hmm.
then spend your money elsewhere, because all of these interventions cost money, and I don't have a money tree, and I'm
Mm-hmm.
sure that most people don't have money trees. So when you're spending on a therapy that isn't giving you any effect, you're potentially missing out on a therapy that will do. Reiki is all about energy, as far as I know. I've worked with a couple of people that do Reiki, and whether it is actually to do with energy or whether it's to do with comfort, time, spending a good quality time with the animal, showing that you care, giving input, whether it's more of a cognitive and emotional effect rather than a transference of energy. I'm a bit with Carrie on it. If it helps, then great. But I definitely, if a dog was in pain, I would go down a route that has more evidence of benefit first, and I would add it. And if it works, then you will be able to lose the other interventions. So hopefully that's a nice, fair, sat on the wall commentary. I know other people would be a lot crueler because it has got a lot of cynicism attached to it. But just be savvy, guys. You could go and have an evidence-based approach, such as a non-steroidal. You see no benefit
Mm-hmm.
whatsoever, and you need a different approach. We've got to be the eyes and the ears and the advocates for our pets. Oh, okay. We've got a question here. Lumbosacral disease on Max Med, still sore, can't touch without hurting her. Have vets Wednesday to get referral for physio. Will physio help with this? I would say so, yes.
I would say too, and again, with whatever you're doing, you need to give it a few treatments. If you haven't seen any change with the Reiki too, if you haven't seen any change after three, you're you're treating the compensation pain maybe rather than treating the underlying problem. So, I would say that's an absolutely perfect referral for physio, and you should see some improvement. And they
Yeah,
would likely give you things to do at home as well. Yeah.
yeah, definitely. And I also am not being a pain, but I know the vet that I was 10 years ago, I would say a statement like Max Meds and not realize that there were so many others.
Mhm.
And the pharmaceutical toolbox is pretty huge, guys. There's all manner of things. There's ketamine, CRIs, ketamine subcut, amantadine, pregabalin, gabapentin, amitriptyline, fluoxetine, lidocaine patches. Did I say them? There is so much
Mhm.
out there that just check in. If your vet feels that they're at the max of their capacity, say, I'm happy to have a referral to a pain clinic, because the pain specialists tend to use drugs that we don't feel comfortable using, and they do it very confidently. And then when it comes to the physio, make sure that you're willing to give the physio time. A lot of the input that they do is going to take time, and they're not going to just work on the primary source of pain. They're
Mhm.
going to be looking to try and make the dog feel better elsewhere as well. So you might see subtle improvement. Might not be Carrie's slam bam, thank you, ma'am. It might be a little bit more subtle. But there are plenty of different approaches. We've got a number of Facebook Lives about lumbosacral disease. So if you type in Tom Harcourt Brown, he's done one. Diane Messam did one from a physiotherapy approach to lumbosacral disease. And the amazing Claire Rusbridge has also done one about lumbosacral disease. So please do have a look. There's a brilliant comment up here. I can confirm
Oh,
Carrie Smith loves what she does.
I
Makes the world.
saw you.
I love that. I love that. And then we've got one here from Sarah. You say three
Oh, hi,
treatments. Can you
Sarah.
clarify timing around those three treatments in
Yeah,
general?
I try to go once a week for 3 weeks, just because they kind of build. If you're only seeing them once a month, you're not. I think those first three treatments need to be fairly close. You could make them a little closer if you wanted to. Like for example, if I had a neuro dog, I would see them like twice a week for 3 weeks, sort of thing. But generally, orthopedic stuff, I once a week for 3 weeks, and that gives me an idea of whether I'm on the right path because I should see some improvement. Now, I always tell the owner it's not going to be gone in 3 treatments, but I've got to see that we're improving. We've got some objective signs that are looking better. That knuckling reflex has improved. The sitting has improved. The eating has improved, right? He got up on the couch to be petted, has improved. So there's got to be some objective changes, by the 4th time you see them.
I love that. I love it. Cool. Well, thank you so much, Carrie. I'm 5 people in one today. I can't believe how bad I've done the lighting this time. I'm on the move. I can't help it. I can't bring my studio with me, guys. Sorry. Thank you so much for such a brilliant live. And thank you guys for listening. As said, on Thursday, we're joined by Chelsea. It's going to be a discussion. Come join us and discuss, because there is no answer for when is enough. What we're going to be doing is talking about how humans cope with the facilities that you have, the capabilities you've got. Remember, I put about $3,000 on my credit card in the last month of Holly's life, and I don't think any of it did anything. So, we have to be honest. Let's talk about emotions.
Yeah.
And that's going to happen on Thursday. All right. Till then, see you later.
Bye, everyone. Thanks for coming. Thanks, Hannah.